I yield myself such time as I may consume.
The gentlelady is recognized.
Mr. Speaker, this rule provides for consideration of H.R. 3631, the Medicare Premium Fairness Act, under suspension of the rules. It allows this body to consider time-sensitive legislation under an expedited process to shield millions of Medicare beneficiaries from harmful premium increases for the coming year. Due to the struggles facing our economy today, many seniors will not receive Social Security COLAs this year, even though the Medicare Part B premiums will still rise. The Medicare Premium Fairness Act addresses this problem by protecting Medicare beneficiaries from bearing the burden of increased premiums because of an economic downturn largely outside of their control. And it does so without adding to the deficit. Without today's bill, seniors who are new to Medicare program will see their monthly premiums jump dramatically. Other Part B recipients will shoulder an unfairly large share of cost increases because of the way current law requires Part B to be funded. And cash-strapped states will be forced to bear the burden of higher Medicaid costs for dual-eligible beneficiaries. For these reasons, I believe my colleagues will agree with me that inaction is not an option here today. As our country begins to climb back out of one of the largest recessions in recent memory, now is the worst possible moment to saddle our seniors with increased premiums. Many respected outside groups agree with his statements and have endorsed the Medicare Premium Fairness Act. AARP, the National Committee to Preserve Social Security and Medicare, the Center for Medicare Advocacy, and the Alliance for Retired Americans have all endorsed H.R. 3631. These groups understand that we are living through a time when rising costs have threatened the health care people in this country have and deserve. This is true for Medicare beneficiaries and non-beneficiaries alike. For this reason, making health care more affordable for all Americans is our top priority, and protecting and strengthening Medicare is an essential part of this vision. I urge my colleagues to support today's rule and the underlying bill so that beneficiaries can continue to see their doctors, so that they can continue to afford their prescriptions and specialty medications, so that they can continue to have money to spend and cycle back through our recovering economy. By acting quickly and decisively on today's bill, we underscore our commitment to preserve Medicare for the millions of people who have earned the security it represents, and who count on the stability and dignity it provides. In doing so, we will keep our collective promise to stand with America's seniors as they age, and to ensure they have the health care they need to live long and fruitful lives. We never forget that Medicare is an essential part of our country's social contract. It guarantees that America's seniors will not be forced to fend for themselves when the economy momentarily turns sour, or when they get sick, or as they age. This is a living legacy of the Medicare program, and it is a legacy we build upon today. But we do not have much time to act, Mr. Speaker. We must pass this legislation before October 1st. This is so that the Social Security Administration can program updated premiums into a system in time to ensure that Medicare premium increases do not hit seniors in their pocketbooks and in their doctors' offices. Speed and bipartisan cooperation are of essence if we are to avoid this problem. The suspension authority this rule provides will allow the House to move quickly and decisively to move this fix over to the Senate. The sooner we have this bill on the President's desk, the better off millions of Medicare beneficiaries will be. I urge my colleagues to recognize that passing this bill quickly is in the best interest of our constituents, of the Medicare program, and of our country. And I reserve the balance of my time.